We're going to be having a discussion with 4 esteemed panelists today. First, we have John Fairest, head of the Global Health Unit at Sanofi. We have Dr. Angela Gichaga, sorry, I'm going to get it, CEO of Financing Alliance for Health. Dr. Mories Atoki, CEO of ABCHealth. And Naveen Rao, Senior Vice President of Health at Rockefeller Foundation. Thank you so much for being here. Yeah. Hi, so we're having a discussion today about global health financing and the financing gaps. And of course, we're having this discussion with the replenishment conference for the Global Fund happening in the background, I will say, for this. And, you know, there has been a lot of discussion about fundraising for that, about how to keep the focus on things like HIV, malaria, tuberculosis. And one, I wanted to start out by asking you all, particularly Naveen and John, what you all are thinking about in terms of your commitments to the Global Fund, where you see needs. We can start with you, Naveen.
John, okay, thank you. Thank you for the opportunity. Congratulate Devex. You always do a great job, and thank you. I have just actually come from the pledging session. It was a subway ride down, and that was the fastest way to get, because it's all gridlock, because President Biden is going to be addressing, in fact, he's on stage right now addressing them. So you can imagine the fastest way was the subway. I'm glad. What was good, so those of you who are not familiar, Global Fund is looking for an $18 billion refreshment. They're well on their way. I think they're 3/4 there. They're on track. What I particularly enjoyed seeing was the various countries who, in their own capacities and however much they could, were contributing, were pledging too. So it's not the traditional donor-recipient relationship. Here it seemed more like partners and co-creation and skin in the game. And that was really nice to see countries come up with 1 million, 2 million, but were putting something into it and not just being, even these were recipient countries, but were still participating and giving. So that is good. Obviously, US is a big donor. All that is happening now. Hopefully they'll get their 18 billion, but this is really important because, you know, in the traditional sense, you always want to double down on what works. And Global Fund has shown that what works is these cross-sector partnerships to look at big problems. So we, Rockefeller, were proud to contribute 15 million towards this fund, specifically to strengthen laboratory systems in lower middle-income countries. We believe that a good, strong laboratory is the basis to be able to address global health. So let me stop there.
So thank you again for the invite and this really interesting topic. Maybe I'll start with a comment on the Global Fund and its operation itself, and the great work that's been done in infectious diseases. And we've seen great progress in malaria and TB and so on and so forth. But I think one thing that COVID has taught us is that people who have things like diabetes and cancer are at huge risk when we see a pandemic like this, and how many people have died because their NCD has not been managed effectively. So I think going forward, the great work that's been done on infectious diseases now also needs to be more investment in NCDs moving forward. Because it's great to cure someone's infectious disease, but if they have diabetes or cancer afterwards and then we neglect them, then there's a real issue. And I think you mentioned the key word for me, which is partnerships, and how we maximize from the private sector, working with the fund to make sure that where the money is invested, it's targeted. It starts with education and infrastructure in many of these countries, and this is an area we're focusing on now with the 40 lowest income countries on the planet. And we have a duty to improve the healthcare ecosystems and train and educate both patients and healthcare professionals before we even look at any intervention from organizations like ourselves. So I think that's the part we want to play in this. But let's not forget the NCDs. Cancer, diabetes, hypertension are really, really important. If COVID's taught us anything, that's where the fund should look for the future.
And I'm curious, how do you sort of make decisions about having to do like both, TB, tuberculosis, malaria, HIV, and neglected diseases? How do you sort of come up with your priorities at Sanofi for that?
I mean, I think it's, everybody says what's your perfect model, but each country is different, each population is different, each healthcare infrastructure is different. But I think the key bit is how you partner and how you get everybody interested, ministries of health, NGOs, training organizations, entrepreneurs. Entrepreneurs in these countries and innovators are incredibly important, and there's many of them. And we have set up a fund where we want to support those innovators to really get going from even seed money, then through setup from a startup company into scaling, and be part of that ecosystem. So we look at prioritizing where we can truly join the circle and make something happen. And the important thing is sustainability, and where we can get sustainability, so where we add to the healthcare system, where we get sustainable treatment of patients for the future, that's where we'll target first, because that's where you want your wins. And the measurement for our global health unit is patient and patient coverage, which is a new mindset from probably where we've been in the past. So that's how we focus our targets.
And I wanted to ask, for everyone on the panel, one of the things that's come up with the Global Fund is this idea of competing crises. We have COVID, we have climate change, we have a food and energy crisis, all of this happening at the same time. And so I wonder how you all are thinking about, and John sort of spoke to this, but balancing all of these issues. And I know, like, for example, Rockefeller, you all have recently announced that you're going to prioritize climate change. How do you still make sure that, you cover some of these other areas, or how do you kind of combine them, blend them together to make a really comprehensive strategy? And yeah, I think for anybody on this panel, how are you all thinking about it? I'll start with you.
So why don't we allow the other panelists to come in, and then I'll come in on the Rockefeller front.
Happy to come in there. And I just want to comment on the first question you had around, the Global Fund and the disease focus. So we do understand that we do have interventions, and we have organizations that have had particular mandates in the past, and they have shown progress with those mandates. The truth is, and I think what has been alluded to here is, when you map the patient journey, the same patient may have HIV and get TB, then get diabetes, and then get, cancer, right? And so when you do have only what is known as a disease focus, you may be able to advance the agenda in that particular area, but the truth is that person will interact with the health system at different types with different ailments. So I like what you alluded to, John, in terms of how do we not think about either a theme-focused health system or a disease-focused health system, but rather think about a platform of delivery and strengthening that across all the pillars, so that then whichever ailment you have, whichever challenge you have, you're able to actually get the quality of care at the time you require with the necessary support. To your question around health and climate, and this then becomes this false boundaries that we have created, right? There's a continuum of systems. If I ask the crowd right now, where does health stop? Where does climate start? Okay. And people are like, oh no, climate is around change of weather. Health is about how I'm feeling in my body. Right, great. Let's look at malaria, right? The cause of malaria is a mosquito. The life cycle of a mosquito and how the mosquito breeds is affected by climate, right? But because we have created these false silos and false boundaries within particular systems, we are then putting systems in competition of each other. And the truth is, in principle, yes, it's manageable that way. It's easier to cost that way, but there are areas of gray. So when we're thinking about health and climate, it should not be from a perspective of competition, but how do we think about complementary investments that then are contributing across that? So you can actually invest in nutrition, and that will also be around good food practices and agriculture, and also helping in health, and thinking about it that way would be, in my view, complementary investments that then are benefiting beyond that one system lens with an approach.
And are there examples of those types of investments that you're seeing? Are there people that you feel like, or organizations that you feel like are really getting it right in that aspect?
I would like Naveen to speak about the investments, or maybe we'll have Dr. Atoki saying something before Naveen.
Thank you very much. Yeah, I think I'm absolutely more comfortable to talk about the investment angle. But I will start with, and my own approach is a persuasive perspective, in the sense that I would like the audience and all of us here to step back a little and think about, and I'm talking from the perspective of Africa as a continent, all of this funding that comes in, the ecosystem itself, the different categories of people in this ecosystem, and what capacity they are each lacking. And so I hear a lot about capacity building, but I'm asking, what are we building? And what is the end result of building this capacity? So for me, I think it's an opportunity. While we're looking at closing the gap, as far as financing is concerned, I think it's important to recognize what the critical key stakeholders are across this value chain or the ecosystem, as we'll have it, and identify what each one of them is lacking. So for example, I will talk about the health entrepreneurs that have the tendency to scale when we have such funding from Rockefeller Foundation and so on and so forth, to scale their existing businesses in such a way that there is more opportunity for communities and a larger part of Africa to benefit directly from them. I talk about the government itself to recognize how does government, who has consistently failed in funding the healthcare, how do they benefit also? Because I mean, I was at a forum, and surprisingly, I heard it was a safe space, so it wasn't anything that. But somebody representing government actually said one of the reasons why they don't attend to some of this, drive towards advancing health, especially by private health professionals, is because they can't identify their stake in it. So, and it's a conversation that needs to be had. What is the stake of government in advancing healthcare, even being driven by the private sector or the private health sector? And that needs to be critically looked at. So when these fundings are coming in, when this, support or financing are coming in, it's important to recognize the critical stakeholders across the ecosystem and know where we need to build capacity. So I tell you a bit about what is going on in where I come from. It's African Business Coalition for Health. And lately we recognized that gap. And we started an academy for supporting health entrepreneurs who already have established businesses, but we think they have an opportunity to scale. Because again, they're doing pretty well, but they don't have enough to go around. So I think this conversation should move also beyond just talking about capacity, but recognizing where the gaps really are and the beneficiaries of the gap, and to what end result with all that capacity birth. Thank you.
Thank you. Yeah, and I think that's a good way to sort of seg into, I know we talked a little bit about building ecosystems and sustainability, but one of the questions that's come up in a lot of panels, I've attended during ANCA, is the question of equity and how do you include communities? How do you make sure you're responsive to them and you're accountable to them? And I think that might be something to get into here too as well. How do you build accountability into commitments that you're making, at a company, at a foundation, as funders on the ground? How do you make sure that you are actually providing the services that are needed and also that are going to be taken?
Shall I go? Yep. So from our point of view, actually, the solution is what you just talked about. So you've actually articulated the problem in the earlier question, and now you're articulating the solution in the later question. It's really co-creating, respectfully building with the local community solutions that they know or that they need or they want, and that hence the gaps that they will fill. Gone are the days, I think we've all come out of that, where the feeling was sitting here in air conditioning, we know what they need in the other side of the fence, and we have an elegant solution that is usually a technology or something, and we throw it across the fence, and we always wonder why. And as the Illumina CEO talked about, it's not just throwing over the innovation. You need the whole system to be able to So I truly feel that this co-creation, local knowledge economy, it's not just the finance economy, it's the knowledge economy, it's the political economy, because politicians are on a 2-3 year cycle, and their election cycles are 3-4 years at the most, and we go to them and talk about a 10-15 year cycle. It just doesn't fit. So how do we speak their language? How do we do political economy, social economy, not just financial economy? And unless we bridge that, we're going to fail again. And just, I remember one thing you mentioned about climate change, because moving to climate change, I really believe climate change is a gender issue, it's a rights issue, it's an environmental issue, and it's not just as we think of climate change in terms of the weather and the climate. It's really transcends all that. I remember being in one of the countries in Africa where it was explained to me that it's so ridiculous, because when the mosquito is flying, it is the municipal, public health municipal part of the government that is responsible. But when it bites me, then it becomes the health. So it's the same mosquito, whether it's flying or biting, is which ministry is taking care of it. So when, we can't parse it out that way. It's all holistic. We need to work together, build the solutions together. And we have attempted to do this by building what we call a vaccine action network, that is bringing in communities, understanding why is there hesitancy on vaccines, why are vaccines not being taken in these countries. But it's not just enough to say the vaccine works, this is the technology, this is the p-value, this is what, but why is there a hesitancy in terms of access? And so the only answer to that is listening to the local communities and then working with them. And so really that is what I think is different, and that is why I'm feeling optimistic.
Stephanie, if I could lean in as well, just to build on what Naveen has said, I do agree completely. What are communities saying, and where do they actually have platforms to come and share what they want to say? So they have to, we need to listen, but we have to create the spaces for them to engage and share their opinions. So how are they engaged in policy and strategy development? The second is not just looking at communities as beneficiaries of services that they're going to receive, but how do we actually help communities get the skills, understanding to co-deliver some of these services? And we've seen this with the work that we do with community health systems, is the community chooses people from amongst themselves and says, we will trust this person from our community and give this person to you, or as a government or a non-state player, to train them so they can give us information so that we can remain healthy, right? And so when they do co-deliver some of the services that they require as a community, they're able to make sure that we are responsive to their needs, and we are also having ongoing adaptability to that. The third thing is, when we are given resources as policy, and when I say we, I'm assuming we are all in some form of private sector, public sector, we are in the policy making space. But when we are given resources and we are dispersing resources, the community is able to hold us accountable, socially accountable. How are we using those resources? Are we doing what we said we're going to do at the time we wanted to do them? So I do think that there's a way to involve communities.
No, I think I agree with everything that's been said. I mean, it's very straightforward in some ways, but it's also incredibly complex. So I think when we look at the financing and the investment in the ecosystem, I really like the thought of the needs analysis that needs to be done in the right place. Gone are the days of just giving a grant and then we see what happens. Now it has to be a very focused, almost like a business plan. There's a start and a finish of investment. I think this is also crucial. And when you get your partners together, they're all accountable for delivering something that is absolutely needed and necessity in that ecosystem, whichever country it may be. And when you do it that way, there's a level of accountability. You want a measurable at the end, but your goal is sustainability. And at the end, you want to leave a legacy of a sustainable, improved healthcare system, for example, that will benefit patients from whatever disease it may be. And then you have to link that with the patient journey. So, in many places, the role of the healthcare professional has changed. The role of the pharmacist in many of these countries is crucial. And I think we've neglected some of that, and the way they can operate in the community is an example. So programs have to match exactly where the gaps are, as you've said. Be very focused, but have a time period on them that we know where we're going to leave and where our sustainability goal is. And the final piece is you need to get a patient engaged as well to understand what the investment in healthcare is. And they have to have a skin in the game sometimes as well, which makes an awful lot of difference in adherence and outcomes of what you're going to get. So I think there's a lot of work to be done on that focus piece. But when we get it right and we close the circle in the ecosystem, we can move the needle pretty quickly.
And I wonder, Dr. Atoki, if you could talk about where you're sort of seeing some of these gaps. You talked about, the focus on capacity building, but it sounds like you've heard from communities about where they are looking for more resources and maybe aren't getting them. So I wonder if you could talk about that.
Thank you. Not necessarily communities. I've had the opportunity to talk to different stakeholders and understand a bit more about where they're coming from and what I think they need. And I'm going to start with, so the SMEs, for instance. So again, consider Africa as a marketplace. The small scale businesses in health. You can tell that they almost cannot particularly put together a concrete business plan to advance towards a potential investor and be attracted to that investor. Even though some of the businesses that they drive are really quite inimical to the needs of the market where they represent. So what that tells me is that there is something missing. This person can promote healthcare, he can do his business well, but he can't scale. It requires funding to get bigger. And at that SME level, it doesn't understand corporate governance well enough. It's just coming straight from the medical school. It doesn't have the background, experience to move the organization forward from where it started to a bigger place. So I can tell what his needs are. If I go to the established health entrepreneur, I know he has a business, probably a family business, and I can tell that the business is thriving, but it's thriving so much because it's in a populated market. So for instance, we talk about Nigeria, there's so many people, and so there's a huge potential there, but there's also the problem of you assuming that you've covered the market because you have access, to the population. And so this fragmented approach towards solving actual health problems in the country that I come from. And then I move to the investors themselves. And I can tell that investors across sectors sometimes are not really drawn towards the health sector. So it's not an attractive place of investment. The health practitioner or the health entrepreneur is upset because the investor never really comes back when they have conversations. He doesn't know why. I mean, he's passionate about healthcare. The investor is not necessarily passionate about healthcare. He wants ROI. He wants return on investment, and he wants it to be defended when he's having that conversation with you. So for me, I think the gaps are in different buckets, and if the conversations are not had in different ways to different stakeholders within the ecosystem, we'll just still be dragging, on this topic and not necessarily identifying what the real issues are in respective places. So I talk about Africa again and different categories. So at subnational level, at national level, at municipality level, in Africa, we call it local government. The stakeholders are different even at government level. And we must recognize what does this even mean to you? So lastly, I'll talk about the government. In recognizing, one of the things that seems to be working as far as health is concerned now that I see is the public-private partnership. And so you can tell for free that the government directly has a stake in it because they get to benefit and the private sector gets to benefit when it brings its technical expertise in health. What this tells me is that if health practitioners or health entrepreneurs are being invested in, it builds a pipeline of seasoned health entrepreneurs that the government can actually take from to build the PPP models at a larger scale, because it's still lacking. It's succeeding in some places, but in some places it's not working. And so, except governments of Africa identify this as an opportunity to build capacity, in these health practitioners or health entrepreneurs, they will still be lacking. If they don't not just build capacity, but also create a forum of helping them see strategic partners to scale their businesses, enough for government to be attracted to those businesses, then we'll still be scratching the surface. And I think that's where we're not still, really communicating. We're largely dependent on grants and support and help. And there's resources within Africa itself as a developing continent. If Africa doesn't get responsible by itself for itself, it will only just get used to taking and not being accountable. And I think that, for me, needs to be really talked about.
Wow. I'm actually sort of curious, and I want to get two different takes. First, I'm wondering what John and Naveen are sort of how you would respond to that as funders who are not in Africa. But then also I would like to ask Dr. Gichaga about your perspective on that as well. So I'll start with you, Naveen.
So we are funding in Africa. We do a lot of funding in Africa, and it's not just in health. We do it in energy and food and agriculture, and I've been there for 100 years. And
my correction, I should say non-African funder. So funders
we're
coming
not an
from
African
outside,
funder.
yes.
I thought you meant not funding in Africa. So no, we're not an African funder, but we're a global funder, and so we believe we're part of the Africa family. And I completely agree with what you've said about as long as this is seen as aid, and there's a donor standing, and then there's somebody, a recipient with a bowl, that equation will never work, and that actually engenders dependency. And after billions of dollars in aid in the last 20 years, we're still worse off than where we started. So that model doesn't work. Absolutely, for not just Africans, but South Americans or Southeast Asians, it's the same story, that unless there is self-respect, unless there is a feeling that of responsibility, accountability, this throwing fish versus teaching people to fish story is coming over and over again. So I completely agree that the way to break this cycle is actually to build capacity, but do it in a way that is sustainable and respectful.
So just to follow from that, having spent the last 7 years of my career mainly in Africa, and we are focusing on 25 of the countries in Africa, and we've actually set up a 25 million euro impact fund, and this is built exactly for what you're saying. There are an incredible amount of innovation and innovators in the African continent, normally driven by a personal event, particularly around health, where they've gone and invented a solution that then needs to be invested in. So this fund is for entrepreneurs, it's for innovators, and we want them to come forward. We'll invest in them, either as seed or startup or accelerator, for a period of time, because we want them to use that to get and use our expertise, maybe from a legal compliance perspective, regulatory perspective, and we help them grow. But we always have an exit time as well, again, because this is something that we want to get them through that journey, and then we want to help another one after that. So the fund is there and it's open to accelerate these entrepreneurs with a business mindset, and also make sure that at some point they become self-sustainable, and we help them on their journey. And at the same time, and you've made this point really importantly, the reason for that is they can then go into the ecosystem where you want them and make a difference, or work with a government or work with an NGO, but make a difference in a patient's life. So that way, we've just started this and we're on a journey with it. We're going to learn, and we need partners to go with it. But it's something we believe will make a huge difference to innovators.
Dr. Gichaga, give you the last word here.
So money. Money is an interesting topic because there are elements of money that people know that are obvious, right? Money helps you get something. You need to make the case to get money. And so what needs to happen is, how do you actually build an investment case to say this is something that is viable and it's investable? But what we fail to fully understand is decisions around resource allocation are not just technical decisions of this is the funding gap, so we put money here. They are political decisions. Why are you putting money here instead of putting money somewhere else? So that's one comment I want to make on what was said. The second is, Are governments putting their own money across the continent specifically, which is the space I know, are governments putting their own money towards priorities? Yes. Okay. And I think, Naveen, you mentioned the replenishment we've just come from. You know, we had Burkina Faso saying we're going to give 2 million and Central Africa Republic 1 million, 1 million. Fine. Is it what they have received? No, but it is an indication that we will have skin in the game, and we all know that public sector and domestic resources catalyze additional investment. What we also need to understand is there are different types of money, and not all money is equal, and not all money is effective the same way, right? So when we look at countries and we say, okay, you're getting grant money, we need to recognize that countries may have started the journey as a lower income country, but have grown into a middle income country. So the type of money, which is usually grant money, is not the type of money that they will continue to qualify for as they grow. They need to recognize that as countries, and we also need to recognize that as people who are allocating of capital. So how do you encourage and graduate and transition countries from being recipients of just grant money and helping them understand that there are other types of money? There's debt conversion, there's private sector, there's blended financing, there are impact bonds. There's a knowledge gap there. And the truth is, many of us, because capacity and capability building, as you said, is a long-term investment, right? But we all want to invest somewhere where we are getting immediate results there and then short-term, right? But if we are allocators of capital, are we willing to put capital to build the capabilities and understanding of this transition, and then we give capital for the transition, right? You can't just give capital just for the transition. So the third aspect as well is we also need to know that not all money is equal. Yes, it is $1, your dollar is my dollar and my dollar, but then $1 of debt needs to be allocated differently than $1 of grant. And $1 of grant needs to be allocated different, because each type of money has different comparative advantages, right? You don't necessarily take debt to cover running costs, right? You want to take debt where you know you're going to get a return of that investment. And so something that might be revenue generating, or something that might have a high upfront capital cost, right? So, but when we think, oh, we have given this country 10 million and we've given this other country 10 million, is it 10 million grant? Is it 10 million of half domestic and half debt? Is it 10 million of a blended finance instrument? You get. So I think that sometimes we think, oh, money is just money. You take money, $1, you take Rockefeller $1, and take Sanofi $1, and someone is better off. But the way you would potentially use money from the Rockefeller Foundation might be very different than the way you'd use money from Sanofi's venture fund. So I think that's one thing. And the other thing is, and we're talking about financing gap, and we haven't gotten to it, and I'm looking at the clock and I'm ignoring it. I think there are a couple of things as well, and I would love to have the audience helping me remember these numbers. So the first number is 66 billion. The second number is 4.4 billion. The third number is 16 million. The fourth number is 5 to 6%. The fifth number is 10%. And the sixth, seventh, I can't count, but I can count money. The last number is, let's keep it at 38%. So what was the first number? 66 billion, fantastic. The funding gap for health on the continent currently stands at 66 billion. That's the funding gap. What is the second number? 4.4 billion. Thank you. These are the A students, okay? I don't know what the rest of the people at the back are doing, but 4.4 billion, thank you so much. Even within platforms of delivery like community health, there is an annual 4.4 billion gap. What was the third number? 16 million. Okay, what is the fourth number maybe? 260 billion. The opportunities on the continent for health and wellness sector is going to be $260 billion by 2030, and has the opportunity to create 16 million jobs. By 2030, Africa's health and wellness sector will be only second to potentially the States. Let that sink. That is not a market that just needs grant money. That is a market that needs private sector investment, that people who are trying to get a return on investment. What was the sixth number? 5 to 6%, and the next one was 10%. African governments committed to giving 10% of their GDP every year to health. Right now, they're hovering around 5 to 6%. So there is bandwidth. Yes, there's limited fiscal space because of debt, but there are very many creative ways of creating fiscal space within government. So I like what you said. People cannot be put off the hook. We need to be understanding, but we also need to help them to be accountable and put some form of skin in the game. But then we have to think about what kind of funding do we give them to complement that skin in the game? And yes, it's grants for certain countries, but there's such a plethora of options that we can be able to create awareness of and then encourage governments to tap into. And I have seriously gone over my time. Back to you, Stephanie.
Well, thank you so much. You gave our audience a little bit of homework, but thank you all for being here today to talk about this.